Hello everyone, I'm Dr. Amer and today I'm going to answer the most Googled questions about heart attack. Question number 1. What are the emergency medications for heart attack? You have to start with antiplatelet therapy like aspirin or clopidogrel. You have to give anticoagulation therapy like heparin or fondaparinux, as well as supplemental oxygen to maintain the saturation above 90. You have to put the patient on morphine if the pain is severe, nitroglycerin if the patient has hypertension or persistent chest pain. Let's not forget high intensity statin, this is very important, as well as beta blockers and ACE inhibitors only if they are not contraindicated. But I should state one very important thing. All of the above, everything that I just said, it is not a substitute to revascularization. It is the main treatment. Question number 2. How can I recognize a heart attack and what should I do? You need to recognize a heart attack by the characteristics of the pain. The pain is usually retrosternal. It is dull, it's squeezing, it's tightening, pressuring. The pain usually radiates to the left shoulder, left elbow, left arm, or left jaw. Usually the pain starts after exertion or after stress, but sometimes it happens on rest. Other symptoms might be diaphoresis, dyspnea, nausea, vomiting, sometimes even syncope, lightheadedness, headache, blurred vision. Question number 3. Can I survive a heart attack without going to the hospital? Okay, what you need to know is that heart attack, it is a very broad spectrum. It has many meanings. In medical, we say acute coronary syndrome. Now, this syndrome has 3 subtypes. It has unstable angina, non-STEMI, and STEMI. The STEMI one, this is the most dangerous one among them. It is also called myocardial infarction, and I believe when people say heart attack, this is what they mean. This one is lethal if not treated sufficiently and quickly. So no, you can't survive a heart attack by staying at home or without going to the hospital. Fearing STEMI or myocardial infarction, there is another case. It is chronic, but the pain in that case resembles the heart attack. We're going to talk about it in the next question. Question number 4. Can I immediately stop a heart attack at home? The answer is no. Acute coronary syndrome, it is a lethal syndrome and it is very dangerous. It must be treated in the ER and by doctors. In the previous question, I mentioned something about chronic case. It is called stable angina. Now, the pain in stable angina resembles the pain of heart attack a lot actually. And the pain can be, let's say, resolved or made easier by taking sublingual nitroglycerin. But I should state something very important. If there is any changes in the nature of the pain for stable angina, let's say the onset, it was different this time, or the duration, or that the pain didn't go away with nitroglycerin, then the patient must go to the ER fearing of unstable angina. Question number 5. What is the difference between angina and heart attack? Okay, so angina, it is a partial blockage in one or more of the artery that supplies the heart muscle, whereas myocardial infarction, or let's say heart attack, it is a complete blockage, so the blood can't go through anymore. In other words, the angina, it is a myocardial ischemia, but it's not very severe to cause changes in the biomarkers of the heart, like troponin, or to cause ST segment elevation on the ECG. Question number 6. How is a heart attack diagnosed? It is diagnosed based on the clinical presentation of the patient, the characteristics of the pain that we mentioned, as well as increase in the level of troponin. Troponin is done on a random blood sample, as well as ST segment elevation on ECG. Okay? Question number 7. How can I differentiate between heart attack and gas pain? Now, we've talked about the characteristics of heart attack in question number 2. The gas pain, it is mostly epigastrium right here in this area, but let me state one thing. Heart attack, it might spread to epigastrium. But how can we tell the difference really? All the other symptoms that we mentioned in the heart attack, like diaphoresis or dyspnea, or the pain that is radiating to the left arm, they don't exist in gas pain. Gas pain would usually feels better or gets easier when you release few gases, okay? And that is not the case in heart attack. As well as when a patient has a heart attack, he wouldn't have energy to scream or to go around the house or to even moan out loud. Basically, he would be very quiet and very still. As for the patient in gas pain, boy, he would have the energy to scream and to go around the house and to make a fuss about it. So only by the appearance of the patient you can differentiate really between them. That's it for today. I hope you liked this video and I hope that I helped you. Please, if you did, subscribe to my YouTube channel, go to the comment section, put any topic you want me to talk about or any question you have for me, and I would be happy to help.